Hello, everyone. Welcome to the IRIS webinar. We're going to bust some myths about dilation today. You may have noticed that you've been receiving some newsletters in your inbox, and this webinar is being conducted in conjunction with those as part of our attempt to provide ongoing support to our amazing clients. So my name is Lauren. This is Rebecca. We're going to be hosting the webinar for you here today.
Thank you guys so much for joining us. I just have a couple of notes for you. So first one is, some of you have already made use of the Q&A box at the bottom of your screen. If you have any questions throughout the webinar, please feel free to enter them in that box. We also want to open up any ideas you have for future webinar topics. So feel free to enter those in the box or reach out to anyone at IRIS. Last but not least is we have a quick poll for you. So I'm going to just share my screen. And we just want to find out what kind of cameras you have and if your organization allows you to use dilation drops or not. This will just let us address some of you a little bit more specifically throughout the webinar. So I'm going to launch that poll and give you just a couple of minutes to answer those two questions. If you're not sure what kind of camera you have, the names of them are on the screen for you.
All right, already getting some answers.
All right, we've got about 68 answers out of it looks like about 100. Get a couple more in and then we will move on. All right, looks like we have a good mix. About half of you are using dilation drops and half of you are not. And most of you are using one of the handheld cameras or the Remedios, and then about a quarter of you are using one of the tabletop cameras. So we have a great mix of everyone. We'll definitely address dilation for all the camera types and natural and drop dilation as well. Thank you so much for letting us know who you are.
All right. So we just want to start off by going over some of the types of myths that we hear. We often are conducting trainings or retrainings where we hear that people have certain ideas about requirements or techniques. So we just want to go ahead and address some of those myths that we hear so that we can bust them.
So we definitely hear a lot that everyone has to take their contacts out in order to capture images with their camera. And thankfully, that is not true. So we can bust that myth. So the only time you ever need to remove contact lenses or your patient needs to remove the contact lenses is if you're going to administer dilation drops. So if your patient has pupils that are big enough that you don't need those drops, or you're using natural dilation, you do not need to remove the contact lenses. Saves us all a little bit of time.
Indeed. All right. Another extremely common myth that we hear is that people think they should only submit images that they think will be gradable or images that are ideal images. And we just really want to emphasize that this is absolutely a myth that we can bust. All right.
Definitely bust.
And the reason for that is we want to give the grading physician the opportunity to see any anatomy possible. So if you're an organization that is only using natural dilation techniques, there are going to be a small percentage of patients whose eyes just don't dilate naturally. very well. And there are a lot of factors that can affect a patient's ability to dilate naturally. And so we want you to do the best you can with the tools that you have. So if you've used all the techniques, and we're going to go over workflow and techniques here in just a few minutes, and you still can't get that patient, their eyes to dilate enough for you to get an ideal image, we want you to take the best image that you can that shows the most anatomy possible to give that grading physician an opportunity to see any anatomy that you can show them. Because if they can detect pathology in the anatomy that they can see, then that image is still gradable, even if it's not ideal. So we don't want to neglect to submit any images at all, just because the images that we have maybe have some shadows on them or don't show all the anatomy.
Exactly. And this is a great example of just what Lauren was talking about. An image that is not ideal. We have a lot of dilation issues going on here. We would ideally like this pupil to be a lot bigger, but in this image, pathology was detected because the camera operator was still sent in this image. So this is a real life patient, and pathology was identified. We didn't miss that opportunity. So we just really want to encourage you guys, get the best picture you can, even if it's not ideal. You can take multiple pictures if needed. So most of those handheld cameras and the Remedio cameras will allow you to submit multiple images. So if you can only get half of the retina in one image, and then you take a second image and get the other half of the retina, by all means, submit both of those for grading.
All right, so now we just want to take a moment to talk about why pupil size matters. Why is it so important that our patients have big pupils when we conduct this exam? So dilation is such an important part of this process because we're viewing the back of the patient's eye, their retina, through their pupil. So the pupil is like a tunnel that we're seeing the back of the eye through. And so as you can see in these two pictures we have up, the portion of the retina that can be seen when the pupil is dilated is a lot greater than that of someone who has a smaller pupil. And we want to give that grading physician the opportunity to see as much anatomy as possible. So we want that pupil to be nice and big. And for all of our camera operators who have handheld or Remedio cameras, you know, taking an image of a large pupil is much, much easier than taking images of a small pupil. So we want to make sure that our tunnel to view that back of the eye is as big as possible.
Because dilation is so important, and you all know that dilation makes a big impact on the gradability and the ease of image capture. We hear a lot of times that all patients have to sit in the dark for at least 10 to 15 minutes before you even attempt to take an exam. So this is busted. Not everyone will need to sit in the dark for a full 15 minutes or even 10 minutes. There are a lot of patients, a big portion of patients will have pupils large enough that you can take those images almost immediately after you sit them in the dark. So we do have some good workflow suggestions to help you save some time, and we'll get to that in just a couple of minutes.
All right, so tap, tap, tap. This may look a little familiar to some of you. We are going to talk about some natural dilation techniques and the workflow that we're going to use. So we thought this would be a fun transition into that discussion. So we want to talk about the workflow that we recommend for taking images. And as Rebecca mentioned, you don't have to put the patient in the room and let them sit in the dark for 15 minutes right off the bat. So our recommendation when you're about to conduct the exam is to bring the patient into the room, get them seated and comfortable, go ahead and turn off the light and leave the door cracked. And at that point, you can go ahead and make sure that the equipment is clean, clean that eye cup, the chin rest, and the forehead bar. Make sure that the order is entered into your EMR or onto the camera, depending on your organization's workflow. And because the lights are off, but the door is cracked, you're giving your eyes and your patient's eyes a chance to get acclimated to the dark. And you can go ahead and explain the exam to your patient, answer any questions that they may have. And at that point, you've both been in the dark for a few minutes. And for some people, for a lot of people, that's going to be sufficient amount of time for their eyes to naturally dilate. And so at that point, you can go ahead and close the door and see if you can get good images before allowing the patient to sit for any additional time in the dark. So for those handheld and Remedio camera operators, you know that when you place the camera in front of the patient's eye, as you're about to move into position, you can see the size of their pupil because there's a glow in the center of their eye, that glow that you're aiming for. So the size of that glowing circle in the center of their eye tells you how big their pupils are. So if you land that camera in front of their eye and you see a nice big glowing circle, that patient doesn't need any additional time in the dark. You can go ahead and conduct the exam. For those tabletop cameras, as you're letting the camera get into position to take the image, it's going to give you an indication either by telling you the pupil size or by showing you the pupil, depending on the camera you have. And so at that point, you can, again, make a determination if the pupil size is sufficient to go ahead and conduct the exam, or if you need to employ some of those additional natural dilation techniques.
Definitely. So once you get your patient in the room with the camera, and maybe this individual, you've had them sit in the dark for a few minutes, and now you're ready to take that exam. And when you align with their eye, or the camera does, you notice that their pupil is still too small. There are a couple of things you can do to help. Now, there are several factors that impact dilation. So not everyone will be able to naturally dilate fully enough for you to get a great picture of the retina. But a couple of things you can do to help. So number one is we want to help our patient relax. So the more relaxed the patient is, the bigger those pupils will be able to get. So definitely explaining the exam in a way that puts the patient at ease is going to help your patients relax. If they know what to expect and they know that it's not going to be uncomfortable, it's not going to be painful, that will help. You can have the patient keep their eyes closed, even in the dark, just minimizing the light that the patient is exposed to as much as possible. You can have your patient, if you're using a handheld camera, have your patient keep their eyes closed until you approach their eye and you're in position. You can have them cover the opposite eye. And then when you're ready to start aligning, then have the patient open their eyes. It's just going to keep the light out even more. We talked about the tapping. That's just going to be a way to relax your patient, distract them from what's going on. So maybe have them think of their favorite song and tap their fingers or their toes along to the beat of that song. So just any way you can get your patient to relax. That's what we're aiming for.
Definitely. So one other thing we wanted to mention is if you do have to let your patient sit in the dark, and maybe your part of your workflow is to, go complete another task while they sit in the dark if you're not with them, make sure you communicate to the patient that they should not be on their phone. So if you leave the patient in the dark room and then they break out their phone and start texting and, playing games, that kind of defeats the purpose. So make sure you're communicating that to the patient that they should not be on their phone while they're sitting in the dark. So have them take a cat nap, maybe do a little meditating, but don't be on the phone.
Yes, no games on their phone. So before I get into the next topic, I just wanted to remind you guys about the Q&A box. Again, if you have questions, go ahead and start submitting those. So the next topic is dilation drops. So about half of you are using dilation drops. So you can actually follow the same workflow that Lauren went over for the natural dilation. So you would begin by bringing the patient in the room turning the lights off after you get them settled in a chair, and keep that door cracked while you get your equipment ready. Maybe you have to enter the order, explain the process to your patient. And then at that point, you can go ahead and close the door and attempt to take the images. And at that point, if you can tell from the screen of the camera or the camera indicates that the pupil is too small, then at that point, you would go ahead and administer the dilation drops.
Definitely. So we don't want to let the patient sit for 10 minutes only to then administer the drops, which take another 5 to 10 minutes to take effect. So we want to make sure that we're maximizing your time here, and that we're not taking too long with this workflow so that the exam becomes too cumbersome. So we just want to talk real quick about the process of administering the drops. So our recommendation is to have the patient be seated, and you can turn the lights on for this. That's not going to affect the dilation drops ability to take effect. So go ahead, turn the lights on, have the patient tilt their head up, and you're going to want to stand on the side where the eye that you're, so in this picture, the person is administering drops to the patient's left eye. So they're standing on the patient's left side. The patient is looking up and to the right. And so that way, they're kind of looking in a different direction as you're coming in to administer the drops. It's helpful to give them a tissue or a Kleenex so that they can dab away any excess. If their eyes water, that can be helpful to have. And so you're just going to take your finger and lower their bottom lid so that it creates a pocket, like in this picture here. And that way you have like a pocket to aim for to administer the drops. And so then you would do that. You would then move to the patient's right-hand side, have them look up and to the left, and repeat that process. And so we found that this is the easiest and most straightforward way to administer drops if your organization allows you to make use of them. I do want to highlight here that you should always follow your organization's protocol for administering dilation drops and for placing those orders. So whatever organizational guidance you have for administering dilation drops and placing orders, we want to make sure that you are following that protocol that your organization has in place.
All right, guys, so that brings us to the end. So feel free, jump in that Q&A box with any questions that you have. We'll give you just a couple minutes to put any in, and then I will get started with a couple that we've received. All right. So I just want to jump back to this slide to address our first question. So one of the questions that came through is about what makes up an ideal image and how do you know if it could be gradable or not? So I just wanted to point out here in this slide, this would be an ideal image. We can see all 4 parts of anatomy here. So we have our optic nerve there on the left-hand side, the macula in the middle, and then our 2 sets of blood vessels, the superior and inferior arcades. So these are the 4 parts of anatomy you're looking for in every single exam. So whether that comes from one or multiple images, these are the parts that we're looking for. So be sure that you can capture those in the smallest amount of images possible. So that's the aim, is to get all 4 parts of anatomy.
Definitely. And I just want to highlight here that we are not saying you should submit images that are not ideal. We're saying that you should submit those if those are the only images that you can capture. So this should be a small percentage of people, especially if you are able to make use of the dilation drops, because you have additional tools at your disposal to ensure that those pupils get nice and big. So we're saying here, we want you to capture ideal images. We want you to capture images that include the most anatomy, all 4 parts of anatomy. but we don't want you to neglect to submit images if the only images you can capture are not ideal. So hopefully that clears up any confusion that you may have had.
Great. So Lauren, we got a question about using blackout curtains. Do you want to take that one?
Definitely. So we like to say here at Iris, the darker the room, the better. So if you're able to employ additional tools like blackout curtains to increase the darkness in your room, we absolutely advocate for that. So we have some clients who have frosted sliding doors, or some organizations who don't have exam rooms that don't have windows. Sometimes it's helpful to designate a specific room where you can kind of make the room a little bit more hospitable to an iris exam by using blackout curtains. So if your organization allows you to do that, we are absolutely all for it.
Great. So we got another question about what happens if one eye is dilated, but the other will not dilate. So this is a great question. It does happen frequently where the image of the second eye shows some dilation issues. And that's usually because the flash from the first image is going to constrict the pupil of the other eye. So both of your eyes are working together to expand and contract those pupils. So once that first eye is exposed to the light from the flash of the camera, it will constrict the other pupil a little bit as well. So best thing to do in that scenario is just wait about a minute before you try to attempt taking an image of the second eye.
All right. So we've got a few additional questions. There's a question about an organization that has a handheld Remedio camera, and they're looking to know if they can order a forehead or chin rest from Iris. We do have a chin rest that can be used with the Remedio camera. So that would be something I would direct you to ask your manager about to see if that's something they're interested in purchasing, but that is something that is available.
All right, our next question for a tabletop camera, does the light have to be completely off? And my answer to that would be yes. The darker the room, the better your images are going to be. Even if your patient's pupils are big enough with the lights on, sometimes, especially with those tabletop cameras, the lens is far away from the patient's eye, so you can get some light interfering from the room in those images. So best if you can keep the lights off.
Definitely. All right. Another great question here. Is there a minimum pupil size that would prevent the grader from reading the image? So again, I just want to come back to what we mentioned earlier about the image containing the 4 parts of anatomy. It's less about giving you a specific number in regards to the pupil size and how large it is, and more about the quality of the image that you're capturing. So if you're a skilled operator, if you've taken a lot of images, you may be able to get an image of a smaller pupil that contains all 4 parts of anatomy. So my guidance to you here would be, go ahead and examine the images that you're capturing and evaluate, does it contain those 4 parts of anatomy? Are they clear and in focus? Is the optic nerve in the correct location? If the answer to those questions is yes, then the image is likely to be gradable.
Thank you, Lauren. All right, so let's go on to the next one. So the next question is, how many times can you apply dilation drops in one exam session? So good question. The protocol is 1 to 2 drops, but definitely check with your organization. Some only allow 1 drop per eye. Some allow up to 2. So you'll need to check with your organization on how many drops you can administer. But once you've reached that maximum of drops set by your organization, that's all you would do for that one patient, is 1 to 2 drops per eye.
Absolutely. All right, next question. Can we use a red light in the room? Definitely. So I will say a caveat to that is try to ensure that the red light is not directly in the patient's line of view. So having it tucked away in a corner somewhere, maybe lower to the ground, like a nightlight type situation, because even though a red light is not going to affect the patient's ability to dilate as much as a regular light will, if the red light is directly in their line of view, it can still affect their ability to dilate. So we just want to be mindful of that. If you are making use of a red light, that the placement of that red light is very mindful, and again, not in the patient's direct line of view.
Definitely. So our next question is, can dark glasses or disposable sunglasses work in a normally lit room so the patient doesn't have to wait in the dark? And this is an option if you have no other choice. However, if you have a space for your patient to wait in the dark, that's going to be best. Sunglasses in a normally lit room is not going to create the type of darkness you need for their pupils to open up enough. Depending on the patient, of course, some patients it would be fine. But if you are experiencing a patient who you've attempted to take their images and their pupil is too small after a couple minutes in the dark, and now they need to sit for about 10 minutes, the sunglasses with the light on is not going to produce enough darkness for that patient. So I would say that's a good solution if you have no space for the patient to sit, or you're taking exams outdoors, or in a home where you have windows. I know we have a lot of patients or a lot of operators who go in home to visit patients. So that could be an option for those situations. But if you're in a clinic where you can have your patients sit in the dark, that would be the best option.
Definitely. All right. Next question. What is the best type of camera to use, table or handheld? And to this, I would say whatever camera your organization has chosen. So I'll elaborate a little bit on that. There are a lot of different advantages to both types of cameras, and each organization has different needs, right? So the camera that your organization has chosen best meets your organization's needs. Tabletop and handheld cameras can all capture ideal images that our grading physicians can evaluate and make diagnosis from. So whatever camera you have is the best one.
Absolutely. So our next question is, should we have the patient cover the opposite eye? And that is a great technique to both help your patient be able to focus on your fixation point. So whether that's a light or an external point, having the patient cover the opposite eye will definitely help with that process. And then it can also help with the dilation because it's creating even more darkness on that opposite eye. And this is going to be a little bit more difficult with tabletop cameras to cover that opposite eye. So it's not as necessary for those, but with a handheld device, then yes, it does help.
Unless your handheld device has external fixation.
Correct, yes.
So if your patient is using the eye that's not being tested to fixate on an external fixation point, you would not want them to cover their other eye. So again, it depends on which camera you have.
All right. So we have a question about tips for eyelids that are drooping. So this is also called ptosis. There's a couple of techniques you can employ. So the first one being to coach your patient to open wide. A lot of times that will be enough for the patient to get that eyelid out of the way of the pupil. So as long as the lid is not blocking the pupil, you should be able to get a sufficient image. If that is not enough, you could ask the patient to lift at the brow with their thumb. So you want to just have them lift on the corner of their brow. If you're using a handheld camera, you don't want their finger inside the eye cup. So very important to keep that as far away from the actual eye as possible. If the patient themselves are not able to do that, so they don't have use of their arms and they can't hold steady, you could have a caregiver do that or find someone else in your office who can do that for you.
All right, next question. We talked a little bit about the possibility of having a red light. The question says, does having a red light in the room really help eyes dilate better? So the red light is not to help the eyes dilate. It's more to give you as the operator a little bit of ambient light in the room. And the red light is the least likely to interfere with dilation. So the red light does not help their eyes dilate. It just gives you a little bit of ambient light if you would like to have that in the room, so that you can more easily maneuver. But as I mentioned earlier, the darker the room, the better. So if you don't use a red light, that's perfectly fine. There's nothing wrong with that at all.
All right, I think this is the last one unless we get some more rolling in here. But the question is, what should I do if the patient can't see or focus on the fixation point? So this is a good question and does take some trial and error, I would say. So a good technique to employ would be to have the patient look at you instead. So you're trying to get them to basically look straight ahead. So maybe ask them to look at your nose or your chin or your forehead, maybe your shoulder or your ear. So just kind of experiment with what they can look at or something else in the room that they can look at to help you get that optic nerve in the correct location. So even if they can't see it, maybe say, look where you think my nose is or where you think my shoulder is. And that will get them looking in a direction, and you can kind of go from there to make some more suggestions.
Right. Another good question here. Do images detect macular degeneration and glaucoma, or is this only for retinopathy? So they will diagnose diabetic retinopathy and macular edema. But some of you may have noticed on some results that they see suspected conditions as well. So they can only diagnose diabetic retinopathy and macular edema, but if they see evidence of other conditions such as glaucoma, they will indicate that and it will come in as a suspected condition. Your organization will have a care plan in place for suspected conditions so that patient can get a referral so that they can have additional evaluation to confirm what the grading physician saw evidence of in their images.
Great. Thank you, Lauren. All right. So the next question is, what is the concern with using dilation drops on pregnant patients? And so there is no contraindication. There's just not been any studies with the tropicamide drops in pregnant patients. So it is not recommended to administer them because there has not been any studies done with those patients.
All right. If the patient shakes a lot, is it okay or ideal to have them lay back to help them be more steady? So you want to make sure that the patient is supported. If they're laying down, it's probably going to be a little more challenging to capture the images because especially if you're using a tabletop, obviously this would probably really more apply to our handheld operators. So I would say the most important thing is that your patient is supported and that you're able to capture an ideal image. So I know some of our, especially the in-home operators, you encounter a lot of patients with mobility issues and maybe patients who are bedridden. So I would say, you know, if there's a circumstance where you have to get a little more creative to capture the image, you know, we absolutely want you to feel free to do that. But you just want to make sure, again, that your patient is secure and supported. And that you're able to capture an ideal image with whatever techniques you use.
Absolutely. You can also have your patient, if you're using the handheld or potentially even the tabletop camera, you can have your patient sit against the wall in a steady chair and put a pillow behind their head, and that can help them be a little bit more stable as well. So we have one question specific to the Remedio camera, and the question is, should you stand to the side at an angle or come straight onto the patient? So that the answer to that is you want to be at the side of the patient, kind of think about the bottom of your camera lining up with the corner of the chair. So at about a 30-degree angle or so, maybe 45, somewhere in there, just to keep the bridge of the nose from obstructing that eye cup or interfering with the eye cup and getting a seal around the whole eye.
All right. So another question regarding certification for drop dilation. So we would defer to your organization's protocols when it comes to internal sign-off and who can administer dilation drops. That varies between our organizations. And so for this specific question, I would say get with your manager to find out who is permitted to administer drops and is internal sign-off required, because that's going to be specific to your organization.
All right, we have another question about specific pathologies and some being diagnosable and some not. And just to answer that question broadly, we diagnose diabetic retinopathy and macular edema because those can be diagnosed with a fundus image alone. Other eye pathologies that we may suspect will need other tests to verify that that pathology is truly present. So that's the reason why we choose to only diagnose those two conditions and only suspect pathology with the other conditions.
Great questions. Thank you all so much.
All right, everyone. Thank you all for your time. It was great to get to virtually see everyone. Oh, let's see, we've got a couple more questions rolling in. Okay, so this question is about cataracts, and sometimes cataracts come back as not gradable, which is it is common because a lot of times cataracts just look like an out of focus image. And so it's difficult for the grading physician to know without other tests whether this is a cataract or some other kind of issue going on with the camera or the camera operator or something like that. So the reason that that's the reason they might come back as not gradable. But the good news is, even if they come back as not gradable, that care plan includes a referral, just like it would if it was truly a cataract. So your patient is not getting skipped over on care. They're still going to get that referral that they need.
All right. Any other questions? Last call before we sign off. This has been really great. I hope that we've been able to address some of your pressing questions and maybe bust some myths that you had about dilation and dilation techniques and requirements. So thank you all so much for your participation and for joining us here today.
Yes, thank you for your time, and we hope to see you on our next webinar.
Keep a lookout in the newsletters. We will be coming back to your inbox very soon.
Bye, everyone.
Thank you.